about a little bit, enjoy the sun. There we go. Now I can see you. Sorry. Do I have approval of the minutes from March 15th? Do I have a motion or any corrections, additions?
I'll move approval.
Okay. Do I have a second? I'll second.
I'll second.
All right.
I'll second. Yes. All right.
Thanks, Bernie. Any discussions? Now, I appreciate Debbie's keeping all this moving and so forth, which is good. All in favor, say aye. Aye. All right, good. Minutes approved. There, so far, we've had a successful meeting. Let's move on to legislative wrap-up. Lee Towers has joined us and gives a little bit of review. Lee?
Good morning, everyone. I pulled 5 bills I thought would be of interest to this group. One we covered last meeting, House Bill 1, Senate Bill 1, HBCU funding bill. If there's any additional questions, if not, we will skip to the next. The next bill creates a hunger-free campus grant program at MHEC. The funding for this begins in FY23, so we have a little time to develop the process and get the word out on that one. That's Senate Bill 767 and House Bill 891. Another bill, Senate Bill 800, the Inmate Training and Job Act of 2021 creates a pilot program at the 4 HBCUs. This also is grant funded. Funding for this begins in FY23 also. This creates programs at the institutions, at the public safety institutions. It's administered jointly by MHEC and the institutions cooperatively with Department of Public Safety and Correctional Services.
That was 150, wasn't it? The funding on that, Lee? The funding was 150?
No, that's 300,000 on the inmate training. I believe it's 300.
Okay.
No, it's more than, 300 in the first year in FY23. Next is Senate Bill 308. Again, it's a promise scholarship bill. We can't have session, it seems, without another promise bill. This one repeals the requirement for anyone 5 years out of high school or longer to submit their GPA for review. This rule will require MHEC to create a new application process, since we've been using, as you know, the FAFSA, which unfortunately the FAFSA doesn't capture this information. So Don will have to develop a new. And last but not least, House Bill 460, Senate Bill 886. This is the Transfer with Success Act. This requires MHEC to require certain institutions that deny the transfer credit or course for an enrolled student to notify the sending public institution and the enrolled student, including the rationale for the denial. This is effective July 1st. And that's the last bill that I have.
Mr. Secretary.
Yes.
I would think that it may be useful, Mr. Towers, for you to send a letter to us and ask for a description of the current food bank or hunger-free programs that are on the campuses already. So
Yes.
I think that might make it much easier for you to write specifications around a grant, so that you already know the kinds of things that are going on.
Yeah, no, that's
a great
very
idea.
good. That's a great idea. I know a lot of the campuses already have, I wouldn't call them necessarily food kitchens, but even drop-off places for people to be able to have food, and some emergency foundations are set up. So I think that's a really good idea. It's much more prevalent than people realize. Sarah, I saw you.
Yeah, I just wanted to jump in. I know we're not included in the grant funding, but we have some programs on our campuses too, and we'd be happy to contribute to the publication of efforts on campuses as well. So thank you.
Would you like to be included in the survey?
Great. Yeah, we'd be happy to collect that information. I mean, if you want to just send it to me, since we're not included in the grant funding, it makes sense not to send it directly to our presidents, but Nikki would be happy to help nail down what is going on our campuses as well, so we have a complete state picture.
Okay.
Okay, great. Thank you.
The one everyone's aware, HB1 was signed by the governor. So the bill has moved forward, and we're now in the settlement discussions with the Attorney General's office. So I want to make sure everybody's aware that that is moving forward on schedule. We have a June 1 deadline in order to get that part of it done. And then funding, of course, is a year and a half out, but just so everybody's aware of that. Okay, anything else on legislative? Any other questions? I haven't heard of any summer studies that we need to get in.
Yeah, I was going to ask that. I think there's going to be some, but I haven't seen them yet either, and we've been asking. So it's just if MHEC hears about any studies that are in the Joint Chairman's report or that are otherwise legislatively directed, if you could just let us know, that would be great.
Okay, will do. Okay, moving right along to the Supplemental Nutrition Assistance Program, and this is something, Sarah, would you have someone you'd like to introduce and have they join? There's, good morning, Provost Young Morgan is here from Morgan. Also now just joined, yes.
Good morning, everyone.
Sure, so
Sarah.
yeah, thank you so much to the Secretary for putting this on the agenda. I'm going to let Bill Davies, he's the Chief Finance Officer over at Mount St. Mary's University in Emmitsburg, take over. This was his concept, and I'll wrap up when he's finished. Thanks.
Great. Thank you, Sarah. Hopefully everybody can hear me. I'm Bill Davies, Vice President for Business and Finance for Mount St. Mary's University. And some of my responsibilities include our dining services and some of the other support networks. Something that was brought to my attention, we actually had a survey of food insecurities performed by one of our professors, and I was astonished by the results. So I really started to dig into why we have food insecurities. And some of the things that I found was some of our Pell eligible students, we've gone from 24% up to 33% Pell eligible. And there's a significant food insecurity problem with Pell eligible students. And there's an awful lot of financial aid that's provided both by the university as well as from the governmental sources. But one of the things that I found is it's very difficult for students to get nutritional assistance. And when I started to dig into what is available, there's a SNAP program from the Department of Agriculture. And when I realized connecting the dots from our financial assistance area that gets all sorts of information regarding estimated family contribution for financial aid, there's to enter into the SNAP program, it's a 17-page document that I would challenge anybody, their ability to understand, fill this out, and get the benefits. It's something that I think we should all look at that form and say, how can we do a better job? I know we can. I have confidence in the system. The funds are available for students, but how do we help connect the dots of all of our financial aid monitoring for a university into the SNAP program so we can really take advantage of the funds that are already available and help students actually eat? There's certainly nationwide studies about students with food insecurities and nutritional deficiencies have all sorts of challenges from an academics perspective, and that's how they really can help. We can help. So it's a very quick conversation that I wanted to have, but I think we should all be charged up because these funds are already available. They're difficult to get to because of the application process. Under the CARES Act, they've expanded the SNAP program to students. There are some limitations outside of the CARES Act, but with work study and other requirements, students are able to participate with the SNAP program, and we already have food on campus. So how do we connect the dots? And that's my press. I've talked to Sarah on this. I think, it's outside of typically what a CFO does, but when you see something that there's resources available and we're not connecting the dots to the students that need them, I think we can do a better job than this. So I really would appreciate understanding of the issue and help us, how do we connect the dots? Happy to answer any questions.
Yeah, Bill, a couple of quick questions. I did take a look at that document and I got to about the second page and I'm going, what the hell? What do you need all this? You know, that it was just not a well-written, certainly not user-friendly for somebody who may be dependent upon support. The second question, have you reached out directly to anyone at the SNAP program to see what provisions could be made to improve it?
That's a great question. I reached out to Sarah. Sarah's our connection back into both federal and state government. So this is really our first foray into how do we build a system that's easier in connecting to those people on our staff who already evaluate financial need. So I think it's really, you know, if somebody says this documentation can be cut in half, it's 17 pages, that's not really the focus. How do we streamline the process? And looking at the financial process that we go through, how do we connect the dots into things that are already done so that it can actually be, you know, come to our university or any university on this call, because we can provide a nutritional program that's assisted with federal funds. So I think this is my first foray into how do we help, how do we connect, and
Okay. Second question was, if someone is successful at Mount St. Mary's in completing the SNAP program successfully, are there provisions set up for the Mount to be able to directly provide food to that student?
well, we're a residential community, so we have full dining services. So the real question is, how do you facilitate the compliance with the SNAP program with our existing dining services? And I got to believe we can make that all work.
I mean, you haven't yet, is what you're saying.
No, it's, you know, something when you look at a 17-page document, you say, what are all the rules around it in each of the areas? This is where we got to get the creative minds together and say, this is what we're trying to do, and these are the regulations written around it. We understand different regulations related to financial aid, so how do we connect financial aid regulations to the SNAP program regulations? So we're not filling out significant applications for students that really just don't have that understanding of the support networks that are available to them.
No, I understand that. Anyone other thoughts? I would think that throughout the United States, this program is available and is something that some institution must have broken through on making it work for their campuses. So that's part of the first part. Maybe we'll include a question on our survey in terms of the food desert or whatever we want to call it on campus when we send it out, to find out what currently is being done, to see if we can find a model that's already working.
I think, Mr. Secretary, what we're hoping to accomplish today with putting this agenda item, put this item on the agenda, is that if there's interest from the other campuses, as Bill said, you know, he's only one campus in NICUA. If there's interest, if there's broad interest across the higher education community, it makes sense to me to have at the agency level for MHEC to work with, I don't know if it's Department of Ag or the Department of Human Services or all three, to actually find out at the very top level how to make this easier for students. The implementation of the program comes later. The problem, as I understand it, is that students aren't even able to become eligible. Like, so we have a cart before the horse problem. And it's, if each institution were to one-off work with the agencies to get this to work on their campus, that wouldn't be as efficient as solving the problem at the top level.
No, I agree with it. All I was saying was determine first if some institution has already resolved this issue and expanding it versus it banging away on the top. But I understand your point. Dr. Young? We can't hear you. You might have to unmute local. Does anybody else have audio?
I cannot hear Provost Young either.
We can feel your smile, but we can't hear your words. Okay, we'll come back while she works on that. Anyone else, any other comments? Well, Bill or Sarah, if you have a specific contact that you can send me.
I can work on that. Yeah, definitely. You mean a contact at the Department of Human Services?
Or SNAP, so we can identify, so we're not going everywhere.
Sure. We'd be happy to work further on it. Thank you.
Okay. I think we lost Dr. Provost Youngs. You might be coming back on in a second, just like I went through. Any other follow-up or thoughts on this? It's an important issue. I know we have a couple community colleges that have over 50% of their students are Pell. And you start thinking about their access to support services. Some of the rural areas also, you know, a high percentage of Pell students, it becomes very dramatic. And for those students that finish, you know, high school and they are in the farms program and all of a sudden they've dropped off, you know, what happens with that? So these are all questions that it's a good point to raise, but we'll look into it, see what we can find out. Okay, well, maybe when Dr. Young comes back on, she might have something else on this. Let's move on to, unless there's something else on this, on the diversity, equity, and inclusion training. At the commission level, we're establishing a committee to do this, and we'll have a couple staff members on HIMHEC supporting it. So we have a next training actually tomorrow on diversity, equity, and inclusion with it's facilitated. And Sarah, were you able to get the contact I sent you, and did you have any other questions on this?
No, no questions. I just wanted to keep talking about it. If anyone had anything to share on campus that they were able to do. I know that we're going to talk about it. The MICUA board meets on May the 5th, and we're going to talk about the kinds of things that are going on our campuses. So by the next meeting, I should have some information about what's happening at MICUA. But I also was hoping that some of you could talk about what's going on in your campuses, and I could take that back to my presidents to let them know what kind of trainings and facilitations and conversations are happening on other campuses.
I think, as you know, that on the public side of things, most of the institutions not only establish offices of DEI, but then facilitating specialists that are embedded in their different programs and have been doing training on campuses at different levels. So, you know, it's another very important issue that's getting a lot of attention and needs to. Anything else on this?
I would say that Dr. Zakili is collating the, it always turns out to be nearly hundreds of pages of reports from our campuses. And as soon as we have those summarized, I think they were due 2 weeks ago. And as soon as those are summarized, Sarah, I will talk to her about sharing that with you as well.
Great, great. Yeah, because we're trying to identify best practices, and to the point of you talk about the student retention and student success, graduation rates, they all go hand in hand. And for those that don't realize that when a student fills out a FAFSA application and lists the institutions that they are considering to attend, the student then receives a Excel spreadsheet, a very short one that's compiled, say that they have 5 institutions. Those 5 institutions have the percentage graduation rate, the retention, and a couple other things. So it's very important to take a look at this as we move forward on what we can do for best practices. Provost Young, did you have any comments on the previous?
Thank you very much. Yes, I did. And thank you. Technology is fantastic when it works. I just wanted to add, I think the point about food insecurity is such an important issue for us on our campus. And I know you talked about possibly putting together a small group to have conversations so that we can address this collectively. And if I lost the connection, but if that is what you decided to do, I want you to know Morgan's very supportive, and we would love to have someone work with you collectively as a group to address the issue.
Dr. Young, Dr. Fielder asked me to go ahead and identify some points of contacts both on the SNAP program and at the Department of Human Services. And if you're willing, perhaps I'll coordinate that with you in reaching out and figuring out who the right people are and what this work group, if there were one, form should look at.
I'm absolutely happy to participate.
Thank you.
Okay. Anything else on this? I don't want to rush through things. My sense of urgency, I don't want to imply that we're rushing along without taking adequate time to discuss thoroughly. I just want to keep us on track. Okay, Emily, the academic comment market.
Yep, this is just an easy one to remind everybody that there are some training sessions coming up. I circulated some of those dates. I know MICUA and community colleges are not necessarily participants in the academic common market, but you are all welcome to attend so that you can listen in about importing students into Maryland, exporting students out of state, and program development and opportunities for that kind of movement of students within the state. So it's open to everyone, even though academic common market right now is only limited to our public four-year institutions. I would encourage everybody to attend. So it's just a reminder that those training sessions are upcoming. That's it.
Okay, and then Emily, the guidance on the high flex courses.
Absolutely. I mentioned this at an earlier meeting. I think it was one of our COVID-19 meetings. We are, Dr. Schmartz was approached a few weeks ago by a number of institutions asking about high flex courses. So high flex courses, as we are defining them, are courses that the delivery is flexible so that the student can learn either through a remote modality or in person. And the intent is that for students who mid-semester may test positive and are attending an in-person class, that they could still complete the coursework appropriately in a quarantine or an isolated way, so that the burden then falls onto the faculty to record sessions, provide lab materials in a remote way. So it's not exactly a hybrid course, it's not exactly an online course, and it's not exactly an in-person course. So for the purposes of counting the type of course or identifying the type of course, your IR folks are in a little bit of a gray territory with these high flex courses. We are not inclined to make a new category right now for the type of course. We want to stick to our traditions of in-person hybrid meaning that it's predetermined at the beginning of the semester what is going to be remote and what is going to be in person. So Tuesday classes are remote, Thursday labs are in person, but that's predetermined and that's what we would call a hybrid. And then certainly full-blown online or remote. So we're going to leave those three categories and provide guidance to the campuses that if there is a high flex course, they default to an in-person modality. We plan on sending out this memo to your IR leadership probably by the end of this week, but wanted to just open it up for discussion and make sure everybody's on the same page. It is likely that we will need to create a new category once the dust settles, but we kind of want to wait a year before that happens. Dr. Schmartz, did I miss anything? Do you want to add anything to that?
You did not. I think just to make clear that the guidance that would go out would be at the course, student, and program level, because we have things that touch on all of those. And so we've done our best to guide institutions to think how to roll up and through all the various scenarios that they might face regarding their own systems and those choices. So I think the face-to-face keeps it really clean.
For clarification purposes, either Barbara or Emily, is this high flex include the definition that it's by student choice as to whether, is that the driver? Okay.
Correct.
Thank you.
I think Provost Young wants to speak.
Thank you very much. We are planning at Morgan to use high flex instruction predominantly on our campus, beginning in the summer and lasting through the fall and the spring. So as you think about the guidance document, I certainly hear you saying that you don't think it's an appropriate time to create a category, but I want to ensure that we have the flexibility to create our category and document it appropriately. So will your guidance give the campuses that flexibility? I don't want to feel that we are relegated, if you will, to having to describe it as an in-person course, because that's not going to be an accurate definition for how we will use high flex on our campus.
So the guidance will be, if you are offering high flex courses for the purposes of reporting to MHEC, categorize them as in-person. You're pondering.
Well, just because, of course, all of that data is collected through our registration system, and in our registration system, we're going to identify them as high flex courses. So I will work with our team to make sure we're clear on how to report it to MHEC.
Okay, good. Anything else on high flex? And is the clarification on hybrid versus high flex going to be also in those guidance?
Yes. Yeah.
Okay. Okay, good. Emily, you want to give a minute on the MFRs, or Barbara, Dr. Smertz? Just that
Sure.
we're working now, managing for results in a pandemic.
Yep. So we, to Secretary Fielder's point, we are evaluating our MFRs, MFR metrics, the managing for results metrics, specifically for the agency, and looking for ways to accurately represent all the work that has been done across the state when it comes to the pandemic, and making sure that those metrics are accurate and up to date. So stay tuned for more. Just know that that's something our agency is working on, and will likely in some way, shape, or form reflect on you as an institution, for the public institutions. We're certainly not making any recommendations about USM metrics or the community college metrics. This is only specific to MHEC metrics, but we want you to be cognizant that we are seriously looking at some changes to better reflect the work that our agency does.
Yeah, we do think we've talked internally about the aspect that this last year has seen so much innovation in higher education and so much progress and positivity and doing things in a different way. And I want to make sure that we're capturing and reflecting this as, again, at the end of the session. So for next year, the legislature can understand some of the tremendous changes that have happened on all of our campuses. That's the aim of this, is to say, what have we done right? And then, some people say, well, let's get back to normal. Well, if normal wasn't working, why would we go back to it? So we're looking for the areas of improvement. Okay, now we enter that period of any kind of member updates. I know that we've been talking, it seems like forever, but about, the return to fall and summer classes and graduation guidelines. And I do think that the conversations with the health department, they were going to try to put out some guidelines about those things. I would capture for a few minutes if anybody had any questions about this.
Secretary Fielder, this is Provost Young. I have one item that the president asked that I discussed today because he could not be here, related to the fall, and that is the topic of requiring vaccinations. As you know, there's been a lot of information about this topic. We had a senior leadership meeting this morning with general counsel and with public health experts as well. And he is wanting us to find out if MHEP is planning to ask the governor or others to make some type of decision on whether vaccines will be required in our institutions, or just what our thoughts are at this point on this topic?
Okay, well, the most recent conversations that I've had with the Department of Health Secretary is centered on the fact that the Pfizer, Moderna, and J&J are all in the FDA's approval for emergency use, but not approved as the normal. And that seems to be the resistance to a requirement. You know, that fine line between, you know, requiring somebody to have something that is totally approved versus an emergency. And that's still being, quite frankly, still being reviewed. You know, there is a strong desire for everyone to urge everyone and encourage, but how do you put out a guidelines as we strongly encourage, you know, every institution to do this? And we all love to be encouraged, but at the same time, it's the difference between being mandated and what all that it brings with it versus being encouraged. So I think we're still looking at strongly encourages. I've asked the question of what is the timeline for the FDA or CDC to move to the next step, and there has not been an answer on that. Joe,
Yeah,
I know you have been meeting and discussing this regularly.
right. And one of the things that we are seeking from the health department and or the second floor is at least a statement that says that they would not essentially that we could make the decision. They wouldn't stand in our way if we made the decision to mandate. I think our decision will be made by the end of the week. This week, that's what we're shooting for, because especially because the so many students have their housing contracts that are due in the immediate future. I can tell you at our board meeting on last Friday, there was a tremendous amount of support from the presidents and from others on the call to in fact mandate vaccinations. And that went for students as well as faculty and staff, because campuses tend to be congregate communities, if you will, moving back and forth and interacting a great deal. Whether we are actually going to get to that point, I can't say for sure, but in fact, the regents on Friday voted to authorize the chancellor to make that decision. So we don't have to go back to the board. We will let them know and talk to them before it's finally announced. But I can tell you that there are a lot of areas converging here to, in fact, lean toward mandating vaccinations, of course, with the exceptions under federal and state law. But we've been working very closely with the Attorney General's office and others. We know that we're going to get, we're going to get whacked no matter which way we go. It's lots of letters, emails, and so on from both sides. And one of the things that the chancellor has said publicly is that he will make the decision on what he thinks is the right thing to do, not because he's concerned about a lawsuit, either pro or con, vice versa, right, or whatever. So we're gathering the final bits of information, but my sense right now is we are moving in that direction.
Thank you so much.
Okay, so needless to say, more to come on that one. And the last topic, just for real quick updates, is Emily and Debbie and myself have been involved with the health department back and forth on trying to get all the students, staff, and faculty vaccinated before they leave campus. And it was proceeding, as most of you know, if not all of you already know, before the J&J happened, we were proceeding toward having, all the campuses receive and vaccinate as necessary with their provider or health centers and so forth. And once that occurred, it's now been decided to move toward getting every student, staff, and faculty to use a MaxVax site. So I just wanted to make sure that everyone had heard that at the same time. And Emily, any update from Tara or Sarah this morning? We have more Sarahs. Sorry, Sarah Fiddler. Yeah.
Yeah, just to echo Secretary Fielder, the plan was we were really pushing that the Department of Health, and they had kind of given us a soft agreement that J&J allocations could go to the universities for the upcoming weeks so that they could be one and done student vaccination distribution. But then with everything that happened with J&J last week, we've had to pivot a little bit to find different ways that we can give the campuses access to the vaccine. So we've pivoted to a place where we're now seriously considering and working with Department of Health on university days at the mass vac sites. So I'm hoping, it sounds like we will be able to get some guidance out by the end of this week, what those university days will look like when they're scheduled. And what it means is that the mass vac sites will block off full days or specific times, and this would be available to students, faculty, and staff, including prospective students that have been accepted to your university. What they would need to share is either a proof of registration or an acceptance letter. Everyone else needs to provide their campus ID, but it will block off time to get people to those mass vac sites as dedicated time for our college campuses. So that's in the works and more to come on that.
Can I ask a quick question about that? Thanks for that information, Emily, and I know you gave it last week at the advisory COVID, whatever it's called, the anti-COVID advisory group. But I thought I heard you say that you're looking at late May, early June, and that's going to be too late. So if there's any way to speed that up, particularly for Moderna, which is a 4-week turnaround time, our students will be gone. And then we're in a weird spot where, I mean, these are 18 to 21-year-old individuals, and they might not ever get that second shot, or they might have complications coordinating. You know, I've heard some people who have moved states in between 2 shots. It's sometimes difficult to get a second shot. So if there's any way to push speeding up this university days, which sounds like a good idea, I think that would be good. But June is going to be definitely too late, at least for our schools.
Sure.
Yes,
So we met with sorry, Secretary.
No, I was just going to say we provided the dates that each of you provided for the institutions in terms of when the students were leaving, so last possible date. So that was provided to the health department, and they're trying to scale appropriately.
Yep. And we've also included graduation dates as blackout dates for no mass vac sites for specific universities to prevent that from happening. We've also included some finals week information based on what is just up on your website. So they have lots of dates and are considering it. Our conversation on Friday with Department of Health indicated that they may have some university days as early as this Thursday or Friday. So they're still working through it. So it's going to be kind of a quick, hey, we've got time for you all, but it's better than nothing. So they are certainly well aware of end of semester challenges and any out-of-state institution that won't be able to get back to a mass vac site.
And I would say hats off for those that didn't know, Notre Dame University opened their doors through their School of Pharmacy, deliver vaccines for Loyola. Loyola staff and faculty were, as reported last week, very, very happy to have that. And that shows that collaboration does work.
And we know this may be duplicating efforts on some campuses that really have had the means and capacity to do full vaccination efforts. We're fine with that. The better we can duplicate, all the better for people to get access. So we recognize that this isn't to replace any of that work, it's just to supplement.
Okay, any other member updates? Okay, seeing none, do I have a motion for adjournment unless someone has something else for the good of the cause? Well, I'll make the motion. All right, for a second.
I'll second it.
All right, thank you very much. Stay safe, everybody. Thank you very much.